Okay. I'm sure nobody envies me right now to be the person to speak after Elizabeth. Elizabeth, also, thank you very much. I have listened to you several times, and it's always, even though I participated in, some activities with the decade, like every time I listen, it empowers me to do more and continue working. So thank you very much for being here. And in essence, I'm continuing with what Elizabeth has already talked about. So the title of my talk is Decolonizing Property Rights, and I will be focusing on health. Health is a human right. All of us know it. And it's something that's often taken for granted. So what I want to discuss today is to kind of bridge the gap between intellectual property and the human right to health, the very essential right to be healthy, to be able to live a normal human life. And before I do, I just like to discuss or to just ask in the room if people here are familiar with certain things. So I'm sure all of us are familiar with the World Trade Organization, right? World Trade Organization, WTO. And I just want to check. So that's the World Trade Organization. And then the second thing is the intellectual property. Do we know what intellectual property is? For example, if I sing a song and record it to the studio, I can secure my song, my creative work, so that nobody sings that song somewhere else and says, I sang this song. So that's a part of intellectual property. So it covers a lot of things. It covers music, it covers industry, so mechanical parts, and it also covers medicine. And that's what I'm going to talk about, medicine. And so I'm a researcher. I am doing a PhD, and my topic is exactly this tension between intellectual property rights and the access to medicine. Because we have come a long way in terms of medicine as humans. A lot of medicine is available to treat a lot of diseases that still plague us. And yet, even though the medicine is there, not everybody is able to access it, not just because they're not able to afford it, but also because laws, and that's exactly the opposite of what we had. So on the one hand, you have, if there's no law, there's no crime. On the other hand, you have, if there's law, there's still crime. So like a law can actually make it possible for crime to happen on a very large scale, and nobody really realizes what is going on. And I'd like to begin with a video. This video is by a campaign based in Johannesburg, South Africa, which I'll be working with in my PhD. So we'll begin with the video, and then I'll come to the topic.
My name is Lillian Dube. I'm a cancer survivor. I had cancer 8 years ago. Now it's come back. It came back in 2000. My cancer is called HER2 positive, which is treated by Herceptin. It's an essential treatment which fights my type of cancer. It has to be taken. Without it, chemo can't do anything.
The first time I heard about Herceptin was in the oncologist's room when he was explaining to me the necessary 12-month program that I needed to embark on. It's unaffordable, totally unaffordable. Where am I going to get 600,000 rand? I might as well sell my house, get better, and then have nowhere to live.
when Dr. Mutli told me that my treatment is AFRICAVENIR, the first thing that came to mind, as a cancer survivor and a supporter, I am with younger women, and I could see them not be able to access this. Until I die, I'll be fighting this.
I was diagnosed with breast cancer. My doctor told me that I was supposed to get Herceptin. Then when I applied from my medical aid, they declined, and they said to me it's very expensive and my plan was very low. I am now using a public hospital, and my doctor never even mentioned Herceptin to me.
It's difficult because you sit with the patient, you see that they're HER2 positive, and you know deep down inside that they need this drug and they don't have access to it. The fact that there's a drug available says that there's been a need for it, and a clever businessman, pharma company, has put the money into the research and development. But once they've made their money back, it should no longer be a matter of profit-driven demand versus access to the drug.
I think if I can get this treatment, it will give me a chance to see my two sons and my grandson growing.
We can make a plan. We can change the law. It will make a huge difference to all women in South Africa.
So this is the campaign that I'm going to be working with the next 3 years. And what brought me to this topic is one very simple thing. So when we create medicine, or as doctors, as health practitioners, I hear when you become a doctor you have to swear about protection of life. You have to swear that you will do everything in your power to protect life. And the problem we have now is that pharmaceutical companies are exactly at the intersection between medical care and business. And the World Trade Organization, when it comes to governance of world trade, it's a very paradox situation, because the World Health Organization cannot do anything. They are powerless. They are not able, when a pharmaceutical company does anything that's against trade law, against competition, against the right to human health, the World Health Organization has no mechanisms to tackle that problem. On the other hand, we have the World Trade Organization, which has a law, and this law is supposed to make sure that intellectual property is used in a way that will encourage or support public health in every single country of this world. So according to the World Health Organization, countries are obliged by law that when they notice or when they realize that they have a public health situation in their specific country, that they make sure that all the rules surrounding trade ensure that this public health situation can be adjusted. But here's the paradox. If I as a country, maybe South Africa, to stay with this example, if I as a South African government say, I have a public health crisis in my country because nowhere else in the world do more people with HIV/AIDS live than in my country, I need to provide these people with medicines. When they do that and create medicines, we have two types of medicines. We have the original designer medicine and then the generic medicine, which is cheaper. So if South Africa creates or starts producing generic medicines, which they're very able and willing to do, they'll be sued by Roche, they'll be sued by GlaxoSmithKline, they'll be sued for making medicines. So at the end of the day, a country that is trying to provide for its people health, not a Mercedes, not a house, health, like the most basic thing, is sued, and not just sued because of damages, they're sued for profits. So the company, pharmaceutical company, will calculate how much money they would have earned in the period that South Africa has been producing this drug, and ask South Africa to pay that money. So we have the paradox situation where we have medicines that exist, the work has been done, scientists all over the world have sat in their laboratories, have cracked their minds, have found medicine for specific diseases, and this medicine just sits somewhere and is sold at a price that most people who need it cannot afford it. So now my question is, what's the point of having the medicine? What is the point of having this medicine if you cannot use it to treat people? So that's my point of departure. That's what interested me, this paradox between intellectual property and medicine. So for the original designer medicines, the ones that are made by pharmaceutical companies, the patents varyingly are valid for between 10 to 20 years. So if a medicine is developed today, the first time any country is allowed to produce copies, like cheaper copies of this medicine, is in 10 to 20 years. We already saw in the video for the cancer medicine used in South Africa, that's 2033. So until 2033, anybody who has cancer in South Africa is either lucky to be rich or has to sell everything that they have, and they still probably might end up dying anyway. And this for me does not make sense, even if it's legal, because all of it is legal. It does not make sense. And a country like India, to show you a maybe positive example and why this topic also interests me, India decided to break the rules. India has been breaking the rules since 2000. What India does is it produces the generic medicine and invites the World Trade Organization to sue them. And with the profits that they make from the generic medicine, they pay the World Trade Organization to leave them in peace. So like India receives in a year about 6 to 7 lawsuits due to intellectual property in the pharmaceutical industry, and they just pay off, like it's a continuous cycle of getting sued and paying, getting sued and paying, because they realize that if they don't do that, because there is a market for the medicine. So about 70% of medicine that is sold on the African continent is generic. That means it's not the original medicine, it's the copied version, and which is much cheaper. So this market is there, and if India decides to stop producing this medicine, I don't even want to imagine what will happen. And so that's what I'm trying to explore in my PhD. And in closing, maybe to make a link to the global color line that we're discussing. So we're talking about a future beyond the global color line. We'd like to think that we've come so far as humans in the world, that everybody is kind of equal. And even if there's inequality, people do not consider the health sector as a place where the largest inequalities happen. And yet, even after catastrophes such as the Ebola crisis or the HIV crisis, even after such situations which show very clearly there's still a very big color line on the medical front. It does matter what the color of the skin is. It does matter where you live. It does matter how much money you have is available to you. It does matter whether you have insurance or not. All of these factors play a very big role. So my argument is that in the health industry, which many of us really take for granted, there is a huge color line, a very big color line. And to get beyond this color line, we're going to have to break rules as African countries and say that we broke those rules and be proud of the fact that we're ready to break a rule to save people's lives, or we will never cross this color line. So it is very important at this juncture to consider that this color line is very real, and people die at this line. People die at this line, and that is why I decided to pursue this this project. And it is not very easy, but I realized that it is my responsibility, that I have to act on the African decade of people of African descent. And if it works well, I will complete this PhD within this decade. And that would be my contribution to the decade. That would be my action project for the decade.
Thank you very much, Eric, for your input. I'm wondering, because it sounds again like a very complex situation, and again, I would like to know, where would one start? Is this the fight or the struggle of only PhD students, or is this something where the civil population can also do something about?
Well, for starters, I think it's definitely not just an issue for PhD students. It's an issue for everybody. And by that, I mean that we need to start really looking at how globalization works. Because we hear globalization has become, it's just thrown around. It's a very fancy word you can throw around. And globalization, internet, Coca-Cola, and so. People, it's thrown around very loosely. What is globalization? What does that mean? Globalization means that a t-shirt which costs €5, right? A t-shirt which costs €5, the people who made this t-shirt are gonna get not even 50 cents of this t-shirt. That is what globalization means. Globalization means that when I'm going to South Africa to do my research, I'm going to pay for a visa to enter South Africa. When my friend who's traveling with me, who has a German passport, is not going to pay anything to get into South Africa. Globalization means that we have very different experiences. Like the same globalization has very different outcomes for different people. So because globalization is always marketed as a very positive thing, because the internet, right? And there are positive sides to globalization, but for some people it is harder to reap these fruits of globalization than for others. And I think we must not forget that. So in terms of getting involved, the only thing I can ask of anyone, who has a life to live and kids to raise and everything, is to actually think about what globalization is. Don't take this word for granted, because it's not just something that is only positive. It is something that can only work because a very large amount of people cannot live healthy lives or do not have access to medicines or work for 12 hours a day and get 50 cents. So these are things we need to think about.
So let's say we did a lot of thinking, and you realized that globalization is not only a positive aspect. What would be the next step after the thinking?
So after the thinking, I think we need to bring this to policy, to policy change. So the ultimate goal of my work is not just to, say, hey, I found out, we know who the culprit is, but to be able to provide evidence when I approach policymakers and say, World Organization, I think we need to change the patent law. They'll be like, why? If this pharmaceutical company put in the work, if these researchers did the research and found the medication, they have a right to be paid. I'm not saying anything against that. But then my question is, how can you sue a country for doing what you expect it to do to protect its public health? That means right now we do not have evidence, enough evidence to pursue or to convince policymakers to make changes. Because every time you go, we know that globalization has different effects on different people, but we do not have evidence for it. So now doing research on something like this enables policymakers to have data on how different globalization affects different people. So my work is just a contribution for somebody else, for people who work in policy circles, for wissenschaftliche Mitarbeiter who work in the German Bundestag or at the European Parliament, for these people to have resources that they can use to prove that globalization has differential effects on different people. And that is something that is not there enough. We do not have enough evidence for the things that we know are happening.
So I guess awareness would be another topic, wouldn't it? In order for, let's say, I'm the average person raising a family, not having the time to do the research that you're luckily doing, how can I still be part of the solution?
I wouldn't say part of the solution, I'd say part of the process, because like we just learned in the previous discussion, this is not something we're going to finish in 10 years. But it is something that we need to work on because we know what it is doing. And I think my expectations on myself have really changed over the years. So at the beginning, I was very eager for solutions. And then over time, you realize that these solutions will not happen, very, very quickly. So for me, it's a process. You have to start somewhere. And for me, it's just taking that first step, not necessarily the first, but taking a step and finding ways, your single piece of the jigsaw puzzle, taking that piece and putting it where it belongs so that somebody else can come with another piece. And then finally we can have the whole picture so that we can present it to people and say, look, this is the picture, this is what is happening. Because the researchers who create medicines, you can ask all of them. All of the people who work for Roche, who work for GlaxoSmithKline, they're good people. They're not making these medicines for these medicines to stay in some cupboard somewhere and cost millions of dollars. Each of them went into this profession because they want to save lives with their profession. And that's what they believe they're doing. But then on the other hand, you have trade laws which prevent the work of these people from having the impact it should have. And I think that is simply unfair, not only to these people, but to the people who are not receiving the medical care that they need. So that's something I'm trying to show or bring out.
I will take 3 questions from the audience. 1, 2, 3.
Thank you very much, Eric, not only for your research, which is very, very important, but especially also for your contribution for the decade. And it makes my heart very proud to hear that you see it as a big contribution to the decade, because also it shows that the impact we can have when we keep spreading the word. So my question is, because you said actually we have to break the rules as African countries. Now, the World Health Organization is now, I think, for the first time that it's led by an African, the former Foreign Minister of Ethiopia, Mr. Tedros. So I wanted to know about your assessment. Would you say this is helping the cause, or is he also just, again, encircled of a broader system that actually is just put at the front to show some kind of diversity? Thank you.
I think I can answer that very quickly.
That sounds good.
The issue with the World Health Organization, like I said, is that they are toothless. They cannot do anything. Ebola crisis, I think some of you remember. The World Health Organization they were too late in declaring the alarm, but even when they declared the alarm, nobody took them seriously. Every government was like, no, we'll wait and hear what the Robert Koch Institute says. Every country was, being very nationalistic and taking their own national health agenda into consideration. Globalization. Today, Ebola breaks out in any country. The next day, it could be in your country. It's that simple. And so we do not have time to be thinking about, we need to, consider. We don't have that time. So, like I said, we need to empower the World Health Organization. In its current state, even with a person of African descent leading it, we still have massive problems, because it can have very good recommendations, very good policies, have a very good foresight and overview, but it is not in a position to do its work. It relies on donations. The World Health Organization is financed by Bill and Melinda Gates. Countries do not contribute to the World Health Organization because they have Robert Koch Institute. Germany, every country has its own, national health organization. So they do not invest in global health institutions because they think we don't need them, because we have our own. Now let me tell you something. Researchers working on malaria in Cameroon might know a thing or two more about malaria than a researcher working in Germany on malaria. You know why? Because they're right there. They're right there. They can see, mutations. They can see changes way quicker than a researcher would need to do. Because for a researcher to research malaria here, you have to fly in the mosquito from wherever. That takes time. The biological material, the DNA material is of lesser quality. It's very trivial, but these are actually things we should, take seriously. So you need to invest in those particular places. So that's empowerment of the WHO and research that is very context specific with regards to health.
Mm-hmm. Thank you.
So there's one more question here.
Good evening, everybody. First of all, thanks, Eric, for sharing your research and also the speakers who've spoken throughout today. I have a question that maybe feeds onto your thought that you just started, and also maybe can be posed also as an idea. I'm wondering, for your research, do you actually have statistics on the demographics of the people who actually participate in the clinical trials? As far as I know, actually before you produce a patent and say, okay, I've discovered a drug and it's effective and it won't cause liver damages or kidney failures, you actually need to conduct clinical trials. And if, for example, you take the case of South Africa, where we have the highest population of people living with HIV, it only makes sense that a lot of these drugs are actually tried and tested on South Africa. And on South African citizens, and if you look at the amount of people, the payments that you get for participating as an individual in a clinical trial, it's pretty high. And I can imagine that maybe someone who comes from lower socioeconomic status will actually participate in this clinical trial, but they are contributing to a much bigger cause and they're unaware of this. So my first question is, maybe, do you have statistics to prove or disprove my line of thinking? And the second question, which is maybe a more or less an idea, can this information then be used as a leveraging point when we're discussing about dismantling these oppressive WTO rules? Because I have lots of friends who are German, who are working as researchers for pharmaceutical hoping to work in companies like this, or hoping to be medical doctors. And all of them, one thing they've said to me, that it's very important for their resume that they go work in Africa or a place that's developing, because there's a lot of tropical diseases, and you won't be accepted into some astonishing institute in New York City if you haven't worked in tropical diseases. So I see this, not only are people in these developing countries denied access to this healthcare, we are also being used and exploited to actually come up with this groundbreaking research. And is there a way to maybe bring light to this topic and actually maybe use this as some way to actually say, hey, you can't do research, or actually maybe encourage more homegrown researchers who want to work into building generic drugs for home to come into the country? I don't know, something like that. Thank you.
Absolutely. I have the privilege, and I didn't know that this was a privilege when I started out, but my sister works for a company that does clinical trials in Southern Africa. And when I realized this, I will actually be speaking to her as an expert for my PhD. She already told me of cases where they test medicine for whichever disease for over 10 years in South Africa, and people actually start getting better from the treatment, and after 10 years, the program is ended, and these people are just left hanging. So imagine you live a whole 10 years, you have been testing a drug, it's working, you're getting better, and they tell you, okay, now the test is ended, this medicine will come into the market in 2015, and then the patent will go till 2025, and then somewhere in 2033, you might get the medicine to buy it in a shop in South Africa. It's ridiculous. It's so shocking that this is actually happening. So I will be working, including this perspective as well. So what does it mean when Africa is used as a laboratory for, clinical research for medicine that they will never get or they will never afford to buy. So that's the first thing. The other thing is also the impact of informing the people who are taking part in this research processes what they're actually doing, even though the payment is very attractive, like what is the impact of what they're participating in. And one thing is escaping me right now. It will come back, I'll answer it later. Was there another question?
Thank you very much for your work, and I thank everybody that is here to participate in this. Database is the nucleus of every research. And I believe India is being able to bring the laws and create those generic drugs for its people because it probably had a database. Now you're doing your research. How can Africa keep data like what you're going to provide for future research purposes so that we can be able also to break laws like the Indians are doing right now?
Okay, before I answer your question, I just remembered the other aspect that you mentioned. So, on the one hand, it's very, it's very well acknowledged when somebody, a medical student or whoever, does a practicum on the African continent or works in research to this particular diseases. So we have a group of diseases called neglected tropical diseases. And this is a group of diseases which is very dangerous, is very deadly, like a lot of people die from them, but no research and development is happening in. Very prominent examples are malaria, which is a disease that kills way more people than it should be killing because it's not that complex to develop medicine for it. But nobody is willing to pay for the research because how pharmaceutical companies work is that they will consider, I'll give an example of cancer. In Germany, a pharmaceutical company knows that the insurance system will pay for cancer treatments of a particular number of patients over a particular number of years. In many African contexts, the pharmaceutical company is not in a position to do this projection. Therefore, they will not see the sense, which is catastrophic. I mean, imagine it. They will not see the sense of investing in research and development of a medicine which they do not see themselves selling. So my question comes back, and this is what the very foundational question for my research is, what is the point of the medicine? Is it to sell or to cure people? Because if it is to sell, then stop calling it medicine. It's a product. You cannot, because a lot of pharmaceutical companies are regarded in high esteem because they're saving lives. And what we fail to realize is that these are companies and they're actually making profits and they are allowed to make profits. But then you cannot neglect the saving of lives, which was the original purpose of doing all of this, for the purpose of making profits only. So I think an important contribution that I will try and make with my research right now, not just for us to be able to break rules, but for us to come and change these rules, is that I want to show the connection between the very, various points that some of you have even raised, and I will acknowledge this group in my PhD thesis, is that a lot of this research or a lot of the knowledge around these topics has not been explored from this perspective. Because we have the research, there are a lot of researchers working on the African continent on malaria. There are a lot of researchers working on the African continent on HIV/AIDS. But whenever they announce anything, they're laughed at. How many African scientists have announced that they've found a cure for AIDS? How many? Nobody takes them seriously. Nobody pays for their research. Nobody invests in investigating what they found out. Nobody collaborates with them because nobody wants to publish with an African researcher. So it's a lot of layers of negligence, of subtle racism, of very weird conglomeration of effects that lead to the situation that we have, that even though we have the capacity to actually heal people, to save lives, we are not doing it because of some technicalities. And I think human life is way too valuable to just let it go to waste because of technicalities, because of laws that we wrote ourselves. If you wrote them yourselves, you can erase them and write new laws. And that's what I'm trying to get us to do.
Thank you.
Thank you so much, and a warm applause for Eric Otieno.